Hey everybody, in today's video we are going to be talking about injury types, their recovery times, and what exactly the different tissues and injuries actually are, and why they take so long to heal, why some take longer than others, and how massage actually helps with this whole process. Okay, so for some people, massage is some crazy magic voodoo that they come in, they have an injury, they get poked and prodded, and they go out feeling much better. They may feel stiff and tight, and they get opened up, and they can move around again in places that they couldn't before. And while that is something that we do, I want to give you the actual reasons why things take so long, maybe clear up some things you've been told before by doctors about recovery times, just so you can better understand what exactly is that we're doing when we do massage, and when you get told you have a specific type of injury and why things take as long as they do to recover. So first of all, we're going to go through the hierarchy of injuries and the different tissues. I've left nerve damage off because that's something a little bit more complex, and it does depend on where the nerve is, certain conditions. Having worked with a lot of people for a long time, should I say, with somebody with MS, I've got a very large set of experience with that particular type of injury. So nerves are a little bit funny. We're gonna leave those off the list for now. I'll probably do a different video on that later, but for now, let's look at the main ones that you'll probably come across before. So, top one is muscle, okay? 2 to 4 weeks to recover. Generally, we've all injured a muscle at times. We are, prone to bumps and bruises and things like that. Okay, so muscle injuries we're probably well acclimatized with, and they normally take 2 to 4 weeks. And the reason for this, and I'll go into details in a minute, is they have a very rich blood supply. Okay, blood gets into our muscles a lot. The pump, as it were, is lots of fluid and blood getting into the muscles. If you cut them, they bleed. They tend to be very rich and full of blood, which is why they take such a small amount of time to repair. As you'll see in a minute, the lower the blood supply, or the more limited the blood supply, the longer these tissues will take to recover. Okay, so next we have tendons. Okay, a tendon attaches a muscle to a bone, or bone to a muscle, whichever way you want to look at it. So they're next, obviously, because they're closest to the one with the richest blood supply, it makes sense that they come next. Tendons can take 4 to 6 weeks. They do have a slightly more limited blood supply, but because they're attached to a muscle through movement and joint manipulation, and not allowing them to go stiff and tighten up, we can expect to see a pretty good recovery time on a tendon as well. That's obviously assuming it's not a full rupture. Obviously, if that's the case, it may take slightly longer, but even then, because of the amount of blood flow we can get to them through joint manipulation, especially if they've been reattached, we can see a pretty good recovery time. Next, we have bones. Okay, so bones are obviously our hard tissue, and they can take 6 to 8 weeks to repair depending on the nature of the break. Obviously, if you completely break a bone, I'm not talking about a simple fracture where it's a part of the bone is broken, it will take longer. They're best repaired under controlled load, which is why you normally get a fixator boot or a cast that allows you to still put load on the bone, but not necessarily load it fully, because it still needs to heal. But because the bones are constantly stripping and regenerating, unless you have a condition called osteoporosis, which I will do another video on, your bones are constantly in a state of stripping and repair. Also, throughout the day, all of our movement and small load impacts that we put on our bones encourage this process. Every time you put your foot down, you create small, tiny stress fractures through the bone material. It then sends these special types of enzymes to go in and do their job. So we want to still continue that process because we don't want the rest of the bone to get brittle. So when we do have a bone break, fracture, complicated or simple, we want to promote still putting a little bit of load on the bone, not too much because we don't want it to change or malform or not be able to set, but we don't want to completely leave it off because we do want to keep that process going. Next we have ligaments. Now ligaments are the ones that you probably will know or have felt the most. ACL tears, ankle ligaments, wrist ligaments, elbows, these kind of things. We know a lot about these. These are the major ones, right? This is where your favorite sports stars, if they have an ACL tear, they're having a bad day, really. Because ligaments have very limited blood supply. They're not great, there's not much going to them. It takes a long time to heal. As you're kind of seeing, the pattern is the more blood you can get to a piece of tissue, the quicker it will heal. Now, ligaments don't have a very good blood supply. They are pretty much non-existent. It takes a long time, but we can get fluid into them, which is why once we get depending on the grade, so quickly, a grade 1 is a mild sprain. You know, you roll your ankle, mild sprain, no swelling, that's a mild bit of ligament damage, okay? Give it a couple of hours, keep walking on it, which is why if you sprain your ankle, the best thing you can do is just keep walking on it. It promotes fluid flow and blood flow to the area to get it healed up. Next we have a grade 2, which is a small tear with significant swelling. So if you do a bit more to the ankle and you really give it some and it puffs up like a balloon, that's what we'd call a grade 2, a sprain, tear. You know, this is where there is damage, but it's not completely severed anything, and the fluid is there again to try and get that job done, which is why also now if you do find you've hurt yourself, prolonged icing of an injury is not encouraged anymore. It is not encouraged anymore. If somebody tells you to ice it up for a while, that's not ideal. Initially, yes, to take the pain away so you can get yourself to a safer situation, then do so, but prolonged icing is not ideal because icing restricts blood flow because it closes down the capillaries, it moves blood away from the cold area because your body wants to try and preserve heat. We don't want to be icing injured areas any more than is necessary because we actually want that inflammation, we want that fluid in that area to make sure that everything's getting what it needs. The body knows what it's doing. And finally, a grade 3 is a full tear. There's no stability in the joint anymore and surgery is required to reattach. Okay, so these are your big ones. These are your ACL tears, your meniscus tears, your medial and lateral cruciate ligaments, the things like that. Usually around the knees when, things go bad and your knees swinging around where it shouldn't be. Okay, but once we've got those interventions dealt with, and we've stabilised the joint either through surgery or just from allowing enough time to pass so we can bear load on it again, we need to keep them moving because we don't want them to seize up, and we need to promote fluid into those areas. Blood and synovial fluid of the joints, these things are things the body creates to push nutrients and clear out anything that's going on. So we want to promote that. If we're not promoting that, your recovery is going to take a long time. Essentially, it will take far longer than it needs to, which is why inactivity and being told to just sit up and rest is going to take your recovery much longer than it should do, because we have to keep getting blood and fluid into these joints, and guess what? That's where corrective exercises come in. Finally, we have cartilage. Now, cartilage is actually a ventricle, anterior, should I say, as it doesn't have a blood supply. Cartilage has no blood supply, but it does have fluid supply. So therefore, through movement, through continuing to encourage movement, stretching, massage in a degree, yes, and keeping hydration levels right and stuff, we can look after our cartilage because it relies on fluid, not blood, because it has no blood supply, okay? It has to have those fluids to put all the nutrients in, otherwise it's going to have a bad time. And in fact, actually, you can prevent cartilage injury by keeping moving, which is why usually when we get older, we tend to be more prone to injuries because we slow down. You don't slow down because you get old because you slow down. The more you keep your joints moving and keep them strong, the longer they are going to serve you for. So now, here comes the real magic and nitty gritty parts. I'm going to break these down into 3 bits, right? Key points. Recovery only occurs when blood or fluids are able to enter the affected tissue. Now, this is why we don't want to apply too much pressure to wounds. I mean, obviously, this is out of crisis time, right? Okay, if you're bleeding profusely, of course you want to apply pressure. If you have a crush injury, you do want to apply pressure to stop any form of toxic shock, but this is past all that, okay? So we're not going to get into the nitty gritty of actual on-the-scene injury. We're talking about recovery afterwards. We need that fluid to be able to enter the affected tissue, okay? So that means if you produce cold packs and put ice on things, it restricts all the capillaries. We don't want that. We want blood to get into those areas and fluid to get into those areas. Swelling isn't always a bad thing. Okay, also this is why we get you to move around a lot, and we try and get you to move affected joints as safely as possible but as often as possible, because movement promotes blood flow. Movement promotes fluid injection into these areas, and this is what we actually need to make sure this is all going to happen. The better the blood supply to the tissue, the faster the recovery, i.e. if it bleeds well, it will heal well. As in, think of your skin. You cut your skin, that thing's healed up very quickly because the blood, the platelets, the plasma, doing all their job, right? Same thing, you just work back. The more blood supply a piece of tissue has, the better it's going to recover, okay? As we see, this is why it takes 12 plus weeks in cartilage, because there's no blood supply, okay? It takes a long time for this cartilage to sort itself out. Again, with ligaments, there's very, very limited blood supply. These are the 2 longest that take their time to heal, which is why, again, soft tissue injuries are often worse than a bone break. And people can't understand why. A bone break seems more severe, but blood is created in the bones for a start, and bones have a constant process of stripping and rebuilding, which is why they take less time to heal up. Whereas these with limited blood and fluid supply are going to take forever. Okay. Also, as a caveat to that, when you are told your recovery time for full recovery could be anything from 18 to 24 months, that doesn't mean you are going to be immobile for that long. What that can mean is that before the doctor or the physio or the manual therapist can tick off every box to say that you are back to a reasonable amount of recovery and mobility, it could take that long. You will be moving much quicker than that, but it's to allow those full finite movements, the full range of motion to come back, etc., that means it could take that long. Obviously, the more you move around and the more you do your corrective exercises and the things that you're told to do, and you find a movement specialist or a trainer that knows how to deal with injury recovery, you will find that this process happens a lot quicker. Having done rehab for numerous clients, a lot of it was promoting small, simple movements every day. Something as simple as going for a walk will help recover an injured knee, busted ankle, minor shoulder movements every day will help promote fluids into the shoulder socket, etc. It's not fancy stuff. It really isn't. Most of it is doing the very basic movements you do every day over and over again to make sure you are getting fluid and blood back into those joints, because blood recovers and fluids recover. Okay, it's not what we do as a massage therapist. It's not the fact that I've touched you that does anything. It's what we're doing to promote blood and fluid flow to affected areas that actually gets the job done. And this is the big one, as I said before. Massage promotes blood and fluid transmission to affected areas along with corrective movement. It is not magic. It's not. As somebody who is a massage therapist, nothing annoys me more than when there are huge claims about how, our corrective techniques are better than somebody else's. You're just promoting blood and fluid flow. That is all we are doing. If you come to us with a tight sore spot on the body, we will promote blood flow to it by aggravating certain areas or applying pressure to a certain point to allow blood to come back into it. We can do mini starve and reflow exercises. And also what we'll be doing is identifying key areas where movement has to be added to allow the fluids and the blood to get into it. Now, sometimes it may be that some of these softer tissues have become taut and tight, in which case gentle, persistent movements will open them out again. That is where recovery techniques come in. But essentially what we're doing is just getting you to get fluid and blood to tissue. Okay, that's what the whole point of this is. We're just a little bit more clued up on where is to do that, and we can speed the process up by manual intervention if needed. If any of you guys have any injuries, you're not even sure what they would even come under these different categories, hopefully I've explained them quite well, but if not, then please feel free to come and chat to me and we'll talk about this. And if you are awaiting for a recovery plan, or you'd like to start thinking about doing recovery, or you just want to know how to move with what you've got, please feel free to come and see me. Get hold of me through the gym or through social media, and we can sort out a meeting point and we will get everything sorted, and at least give you some peace of mind as to where you can go next. Speak soon, guys. Bye bye.